for subcutaneous abscesses is incision and drainage followed by wound packing. This is thought to aid hemostasis and prevent reorganization of the abscess. Removal of packing material may be painful and difficult. We sought to determine whether packing could be omitted with equal efficacy. 100 pediatric patients with subcutaneous abscesses were enrolled between May 2008 and December 2010. Patients were randomized to the packing group or non-packing group. All underwent incision and drainage, then 7 days of oral antibiotics and warm soaks. Packing was removed 24 hours after the procedure. Patients were re-evaluated if recurrence was suspected during follow-up calls on postoperative days 7 and 30. Patients were excluded if diabetic or immunosuppressed, the abscess was perianal, or the abscess was secondary to a previous operation. 85 patients completed the study, 43 in the packing group and 42 in the non-packing group. The two groups were not statistically different with respect to initial parameters or abscess locations. The incidence of MRSA was similar between the two groups. There was a single recurrent abscess in each group. We consider the pain and anxiety related to packing removal to be significant. Pain scores were not specifically evaluated in this study. It is reasonable to conclude, however, that the absence of pain in the non-packing group can be considered an improvement over strategies that require packing removal. The size of the initial abscesses in both patients that had recurrences did not appear to be a factor, as they were each 4 centimeters in diameter. This was less than the mean diameter of abscesses in both groups. In one of the non-packing group patients who had an abscess on the thigh, a separate drainage was required in a second location 7 centimeters from the initial incision. The second lesion may have been unrecognized or not fully developed at the time of the initial procedure. It is unlikely that the placement of packing in this patient would have prevented the second abscess. To be clear, we believe that the non-packing approach can only be successful in the presence of a number of additional factors. We advocate an adequate skin incision for subcutaneous abscesses, followed by a thorough exploration of the wound with an instrument to break up loculations. This is followed by copious irrigation of the abscess cavity to expel any residual purulent material. Subcutaneous abscesses treated by incision and drainage without packing have the same low rate of recurrence as those treated with packing while omitting a painful component of therapy.